Ms. Bowie, please do the roll call.
Stephanie Adams.
Here.
David Wortman.
Here.
Nelson Boyer.
Here.
Lisa Eastep.
Here.
Judy Justice.
Here.
Jeanette Nichols.
Here.
And Bill Ravenbark. Mr. Ravenbark?
All right, the next item on our agenda is the approval of the agenda. Is there a motion?
Move to approve, Mr. Boyer.
Thank you. Second?
I second the motion. Jeanette Nichols.
Thank you. Any
Just don't have to do that
discussion?
anymore.
All right, Ms. Bowie?
Miss Adams?
Aye.
Mr. Wortman?
Aye.
Mr. Boyer?
Aye.
Miss Eastep?
Aye.
Miss Justice?
Aye.
Miss Nichols?
Aye.
And Mr. Ravenbark.
A little bit. All right. Next item on the agenda is for information, New Hanover County COVID-19 update, and we are very grateful to have members of the health department here this evening. This past week at our meeting on Tuesday, I will own the fact that they were not here. They have been working alongside our senior staff and have been sharing data, sharing feedback throughout this entire process. And so when the recommendation for B came down, I believe that Dr. Faust was comfortable through the discussions, but I now see that the community wanted to hear directly from you. So if I could invite you all up, please, and you can share some information. Hello, sir.
Good evening. Thank you very much for inviting us. We appreciate it. I am Carla Turner, Assistant Health Director with New Hanover County Public Health. And as of 4 o'clock today, we had just over 4,400, we have had just over 4,400 positive cases of COVID-19 in New Hanover County. Of that, yesterday I looked at our data through 1 o'clock Saturday afternoon, 2 days ago, and of that we had 88 positive cases in the elementary age students, which made up 2% of our total positives. We had 45 positive cases in our middle school ages, which made up 1.05%. And we have had 95 cases in the high school population, and that makes up 2.2%. Now, of the high school population, I pulled out 18-year-olds because the majority of 18-year-olds have graduated. Of the 18-year-olds, just as a matter of information, we have had 211 positives in that range, and that makes up 4.9% of our total percent positives in New Hanover County. We have seen in the last 3 weeks a spike in our 18 to 24 age range. Last Thursday, the 10th of September, 18 to 24 actually surpassed 25 to 49 in our total positives in New Hanover County. We have had 32 deaths in New Hanover County as of today, through today. Every one of those, with the exception of, and I'm doing this from memory, so I apologize, 2 are in the higher risk age category, and all but 2 or 3 had underlying health conditions. We continue to see testing opportunities throughout the community. Our testing in New Hanover County Public Health is now focusing on our historically marginalized communities, reaching out to our Latinx and Hispanic communities as well as our African American communities, and we're moving forward with mobile outreaches where that's concerned. Any questions you want to ask me based on that, or just in general?
Yeah, I have a couple. Is the recent uptick that we are seeing directly attributable to the situation at the university? That's what we hear, that's what's reported, that's what's rumored, but is that where we're seeing that uptick?
We are seeing the uptick in that age range. 18 to 24 is where we're seeing the uptick. Do many of those students go to UNCW? They do, but not all of them. We've had some students from Carolina State, ECU, App State, who have come home, who are positive, who are attributed to our county. But we can't say that all of those are specifically UNCW students.
Okay. And how many people have recovered?
Oh, gosh.
You said recovered?
Yes, I'm trying to picture our graph. At least two-thirds of that 4,400 plus have recovered. I'm sorry, I can get that information and get it to you.
That's fine. I just was curious about, because the numbers always keep going up and people forget that as time passes.
Yes, and the definition of recovered is 10 days past symptom onset with improvement of symptoms and at least 24 hours without a fever. So with the uptick we've had in the last 10 weeks to 14 days, we're going to see what seems to be a lower percentage of recovered compared to the total number, because we've had such an uptick in the last few days. We had, I think, 61 positives today. But that was for today and Sunday. So in the last 3 days, we've seen it come down. But we just have to wait to see what this week brings us.
Okay. And I do have one more question. And I don't know who would speak to this, but there's a lot of talk or a lot of data about the lower rate of infection and also the lower rate of transmission with this virus among school-age children 10 and younger. Can you speak to that? Can you explain that to people so they might be able to sort of, better garner an understanding of the risks?
Certainly. I mean, I think the Secretary, Philip Tart, Public Health, I think the Secretary mentioned that the 0 to 17 age range, and Carla, please chime in, accounted for 1 death and 11% of all cases statewide. Our particular situation is about 5% of the population within New Hanover County doing in that. 10 clusters statewide, impacting about 16 student, 46 staff members. The physiological reasons as to why, we don't have a good handle on that. I can honestly tell you that. As much as we do not have a reason as to why certain individuals have certain organ failures and or conditions that they would not customarily have without comorbidity. So, there's more to know, but we do know that there are statistically lower cases within that age range. Does it mean that age range particularly cannot transmit the disease? I know there were statistics about lower transmission. I would say I'd still believe that is not necessarily as well known as it should be at this point. It's just the numbers that we find ourselves now. So not a long-winded answer around that, but we just don't know enough about that at this point. We just know what the statistics tell us moving forward. Now, what does that mean moving forward? It could change. One thing we know that this is not a consistent virus, and we don't necessarily know what it's going to do in the future, but we should know more as we move forward. And we are currently working with our state epidemiologists to discover more of those answers as we move forward, specifically as to the point where we get to a vaccination for the virus. But we don't have specific answers to it. We just know that it doesn't impact them as much. Doesn't necessarily mean that they might not transmit it any faster, but it certainly doesn't make it any safer either.
So let me just ask you point
Sure.
blank then. We are considering a move into Plan B. You are
Correct.
aware, I'm sure, because you're on the work study group.
Correct.
You're aware of our mitigating measures that we're proposing. Is it your opinion that such a move would be safe as long as we implement those mitigating measures?
So let me back off from safe and talk about dependable and reliable as opposed to safe. We're going to continue to support that from the county's perspective. I think where you are right now in a distance learning format, considering moving to a full-fledged, and I have a child in school, by the way, moving to a full-fledged school year. I would say we would support whatever, again, is somewhat defensible. would a recommendation, I know the governor's recommendation was that schools can open. I would say that's a recommendation. I would not necessarily say that was a requirement. And depending on the system that I was in, and if I was in a system such as a Columbus, and I might use Columbus County where I grew up, where the rates are higher, considerably that would be a different conversation. But that being said, we have done a very good job collectively, and I will give kudos to the school system here working with us as well as UNCW, of ensuring that we have taken the past few months to include my son back last year in distancing, mask wearing, isolating, those particulars that have helped curb this situation. We're not out of the woods. I'm just going to tell you, we're not out of the woods, and what we have done is a very good stance in curbing this condition in our community. There's still a lot to do.
Can I go back some?
Certainly.
Because she was asking for questions first. According to, and I lost, the figures are, during August, there was nationwide a 16% increase with school-age children. Is that correct?
Nationwide, I do not know. I know across North Carolina, we sit on state health department calls every week, and at our last two calls, the state epidemiologist, Dr. Zach Moore, has shared that in North Carolina, in those counties that opened with Plan B, we have not seen an uptick in positive cases among school-age children. As of last week, we've seen a slight decrease in that age group. And I would just speak.
Ms. Turner, can you come over to the mic?
Sure, come
Sorry,
over
thank
here.
you.
Sorry about that.
Thank you.
Thought it could be loud enough for everybody to hear. According to State Health Department, Dr. Zach Moore, with the schools in North Carolina that opened under Plan B, there has not been a significant increase in school-age children becoming positive. And actually last week, they reported that there had been a slight decrease in positive cases among school-age children. And I will say, along with what Philip was saying, one of the benefits of what we have been doing with the schools for the first 9 weeks being in Plan C is that our school nurses came back August 11th and have been able to work diligently with your staff at every school to make sure that we have measures in place for when you do determine it's time to move forward with the next step, that we will have the measures in place to help protect your students and staff as best possible based on the decisions that you make.
Okay, now Plan B is what you're talking about. And I
Yes,
believe that's
yes,
what you're
ma'am,
referring
Plan B,
to, too.
yes.
Which you weren't here unfortunately last time, and I would have liked to have gotten a fuller knowledge of it then. But right now, decisions that we're talking about is Plan A. And that is a big leap. We haven't even gone back into Plan B. That's why I said there has been an increase nationwide. But then nationwide, everybody's increased their numbers. You said the numbers had gone down a little the last 3 days, but you said the death rate was 30?
We've had 32 deaths since
32. There was
since our first
29
positive.
on Friday. From what I
Yes, ma'am.
understand, there's 29 on Friday.
Yes, ma'am.
So there's been 3 deaths in the last 3 days.
Since Friday afternoon through
Right.
today, yes.
And also, the last couple times that the numbers have gone down, then they spiked almost immediately afterwards. Isn't that correct?
Well, I will say the last time we started off obviously when everything started on March 19th with the low numbers, and then the numbers began to increase as we opened things up more in the state. We managed to come down in August, and we went back up middle of August when that 18 to 24 age group returned to New Hanover County for whatever reason. That is who we can attribute the majority of our increases to in the last 4 weeks.
And those people are in our community now, correct?
What now? I'm sorry.
Those people are in our community now, correct?
Some are, some have gone home, but no, those are still in the community.
And some of them possibly could be in our schools helping, because I know we've hired UNCW students in the past that might be carriers and asymptomatic. That could be possible, correct?
It could certainly be possible, yes, ma'am.
Okay. Now, as far as, my goodness, I guess I'm still a little surprised about the death rate increasing. I didn't know it had gone up that much in the last couple of days. Now, nationwide, well, actually the state, what the governor said about the state opening up to A, he said it was up to the individual districts to make that decision based on what was happening within that district, correct?
Yes.
Okay, and The statewide rate, I believe, is something like, do you know what is the statewide rate? for
I do not
infection?
have it in front of me. I wanted, Julie, did you have that, Ms. Barnum?
Statewide rate for, well, I can give you these statistics. From 0 to 17, they account for 1 death in 11% of all cases.
I'm looking for the percentage statewide.
The statewide percent positives for the past 2 weeks is under 5%.
Okay, what about our local statewide percent positive?
You mean New Hanover County
Yes.
positive? 2 weeks ago, we were at 11.8%, which was directly attributed to the folks who had come back
2 weeks ago?
2 weeks before that. Remember, between 2 and 14 days is when you
But
start to
still,
see
most of them are
symptoms.
still in our community. You know, everybody keeps attributing it to UNCW. In another couple days, we're going to get it out from Labor Day. There's always going to be something you can attribute it to.
Yes,
The
ma'am.
thing with the UNCW students, they're here. I mean, the Labor Day people, a lot of them,
Sure.
you know, okay? So, I mean, I appreciate you saying that, but you say it repeatedly as if it's
Yes, ma'am.
increasing. And it was at 11%. What is it now? Do you know?
Now it is, as of last week's data, was 9.5% positives in New Hanover County.
So that's still almost twice as much as the state average.
Yes.
And so he said it would be up to the individual districts to make that decision based on what's going on in their county, correct?
Mm-hmm.
Okay, so honestly, you say you have a child going to school here.
I do. He actually said it was a suggestion.
What was
from
the
the
suggestion?
The governor.
So you're absolutely correct.
Okay, so, you know, and I have a couple grandchildren, and I think everybody's got kids or no kids, or, I've had individual professionals in this district that are medical people say they would possibly send their kids back, but they absolutely would not because of what they know about the possibilities of infection. So how about you?
You mean for Plan A?
Yes. What would be your recommendation there?
For Plan A.
Yes,
Well, I would ask some questions if I may.
sure, go right ahead.
So I know we were talking about, so even if we go to a Plan A or a Plan B, obviously buses, we were talking this morning, buses are going to run at 100%. So that's non-school related, but it's within your realm. So I would say, what is our plan for isolating or socially distancing those kids on a bus? I would go back and how could we and how will we ensure that policies and protocols are met on mask and distancing and hand washing, particularly for 0 to 5 years of age. I would also ask, what's the plan should a mass outbreak occur and we have to, and you have to backpedal? Just thinking about how we do those issues versus a Plan A, even versus a Plan B, but thinking about a Plan A for 0 to 5. Those are the things I would think through from a perspective as a priority setting measure. Not necessarily saying one's better than the other. We're certainly going to utilize our skills and our nurses and our clinicians within the school system to be able to train those staff. The idea is within the school setting is one thing. We understand you've got 15 to 25 kids at that age group that are in classrooms. Can you properly social distance them to meet those requirements? Can you assure that they're wearing face masks? Can you assure that hands and mouth, eyes and nose aren't going to happen? A lot of questions that happen from a 0 to 60 kind of item, from having no classroom to full-blown classroom. Is there a benefit to moving it forward slowly so we get to a January timeframe and then realizing, you know what, we have a vaccine, or better yet, that our school system is doing very well and our numbers are dropping, therefore less exacerbate and move forward. I go back to say that the governor came back and said it was a suggestion within our district. I will go back and talk, and by the way, Tafana Brelli Thomas, I'm so sorry, she's assistant county manager, but was a long-term school system employee, and thank you for being here.
What's he saying?
Well,
What are you saying?
but I think with UNCW and thinking about that, you know, that age group doesn't necessarily attribute to a UNCW issue. We do have kids coming back to our region, we do have, but that age group does. So, but that being said, long story, there are a lot of these with the buses, insurances, teachers in the classroom. How do we ensure that these protocols take place, knowing that we have COVID in our community that's still active and still moving forward? Now, I'm not suggesting one way or the other, but I'm just telling you that COVID is still active. It is still a real concern. It is still an issue for us in public health. And when I think about the issues that I would have ensuring that I had the distancing, again, I go back to the buses. This morning we talked about that at length, where we're, one thing in the classroom is one thing to have 60 on the bus. How do we do that effectively with a full-blown schedule? Those are issues we have to work through. And I would reiterate one more time, should we get into a situation where we're in a plan A, and 4 weeks in, we realize that the entirety of that group, while they might not be susceptible to death and injury and transmission, but there is a risk of that, it's not necessarily zero. So while the Secretary says they are lower risk, there is a risk. And when we think about parents and single individuals and grandparents raising children, there is a true issue moving forward.
And the fact is that the students that ride the bus are usually the ones that can't afford to have their parents driving them in certain ways. And so they might even be more susceptible because of that extra added exposure. And I appreciate the fact you really didn't answer my question about your child, and I shouldn't have put you on the spot that way. That was rather
But it was
pushing.
my child?
Yeah.
Yeah, thank you.
Yeah, but I have a lot of parents that are asking me that question, and I
Right.
can't answer it. I'm listening to you. You're the ones that can give me the answers. And the fact that we're double the number of the state as far as the infection rate goes, we are a tourist industry. We've got the university here. We have a lot more. We're very tightly packed. We're a lot different than other counties. And I know that you all you can do is give us information. You can't
Right.
really make recommendations because that's not your area. That's what we are supposed to decide. But I think the figures speak for themselves. And I really don't, know what else to ask except for the fact that this is a very scary situation. And we're talking about, if we go to a plan A, I still have questions about B, but plan A, that's just sounds very, very dangerous for the population that works in the schools. Especially, I'm concerned about the staff. I just heard today, and I didn't realize, and I should have been paying more attention during the last meeting, that the bus drivers, they were intending to take the temperatures of the children getting on the bus earlier in the year, and then that's been taken off the table, and they don't take the temperature until they get into the schools. Well, here we go again talking about that particular population, and they're the ones that are most at risk right now in the highest numbers. So as a representative of those people, I want to be able to have a voice for them too, and that's why I need this information. Thank you very much.
Ms. Justin, if I could add, and not to elaborate, but even thinking about the social issues with children, I think we in public health really understand that isolation with kids. And we understand the dynamic, and I know Dr. Faust talked about this. We really want to pull them back into the mix to have that interaction that's so important with learning. We understand that as well. I think we'll get there. This is unprecedented times that we haven't seen. But at the same time, we want to make sure they have that opportunity to get to that point of association because we don't know what this can actually develop into.
And I think that's what B was predicated on. I'm also concerned about the flu season, which is literally in a matter of weeks. Could you respond to what that could mean running into what we're already experiencing with COVID?
Yes, ma'am. We are concerned statewide about the possibility of flu and COVID running around the community at the same time. There's a large push at the state and local level for folks to get their flu vaccination. We are, as we always have in the past, going to offer flu vaccinations to your faculty and staff, K through 12, and we're also, when the students do return to school, Plan B or whatever you choose, then we are going to offer that also to the students in middle and high school. We're going to offer the flu vaccine to them. There's a huge push for flu vaccine, and a big piece of that is if we have COVID in the community and then we start seeing an uptick in flu in the community, we have the potential of overwhelming New Hanover Regional Medical Center as far as sending folks to the hospital, and at some point they can't accommodate but a certain number of people. So we want to do our best to get a hold of flu before flu becomes an issue. So we are pushing the flu vaccine at the local level.
Thank you very much.
Mr. Chark?
Wonderful of you to offer. I have a question that I want to go back to from a while ago, actually. You shared the data for students that have gone into Plan B across the state. What is the data for our teachers and staff that are working in our schools from an infection rate perspective?
I can tell you that the percentage positive of the 25 to 49-year-old age range is right at 34%. So about 34% of our positives in New Hanover County are the 25 to 49-year-old
But
age
no,
range.
I'm speaking specifically, and you may not be able to speak to this, specifically the schools that opened in B across the state.
Oh, okay, I'm sorry,
Do we
no.
know what type of infection rate? Because you said that there hasn't been, the numbers have not gone up in those schools
No, ma'am, according to Zach Moore, that,
from,
yes.
for children. But
Well, you
what
know, now
about
that
for
you
the
say that,
adults?
Ms. Adams, that's a good question. He said we've not seen an uptick in numbers in the schools. My assumption was you're looking at the school-age children.
Okay.
But, and I can certainly dig into that deeper for you and send that information through Ms.
I'm-
Varnum to you.
it's
Yeah,
just
that's a
that-
great question.
That's a really important data piece because our schools are our students, but they're also the people that are sitting in this
Yes,
room.
ma'am.
And,
Right.
and
Yes,
our
ma'am.
bus drivers and our custodians and our central office staff. So I'd be interested. I know that a lot of the schools that have opened in B seem to be doing really well. And they're mitigating the risk and they're washing their hands and they're wearing their masks. And the schools that are doing that seem to be successful. I'm curious though about staffing, how it's impacting them.
And I will share with you, I live in Pender County. My two daughters went back to school with Plan B. My youngest has special needs, so she's in school 4 days a week. Things have been good. They keep a mask on. They do a really good job. And my 16-year-old, she's got 2 classes at Topsail High School. One has 4 kids in it, and one has 10 kids in it. So they've done a really good job as far as social distancing and putting all those mitigation measures in place up there.
Thank you.
That kind of leads into one of the questions that I have. We talked about buses and children going back to school. Has there been any uptake in the last 5 or 6 weeks kind of in New Hanover County of any transmission rates for school-age children?
I have not seen that, no.
Okay,
Like I
and-
said, our largest portion of increases has been that 18 to 24-year-old age range.
Okay. And then also we have a number of charter schools that are back face-to-face full-time. Driving to work every day, I always pass the Roger Bacon bus and the Charter Day bus with students on it. Have you heard of any outbreaks specific to those schools, those that are actually utilizing the buses or staff or anything like that?
We have not, no. And quite honestly, when we get a positive, when we call an interview, obviously if it's a child, we're going to interview the parent. Our information is only as good as what
Right.
that parent is willing to share with us.
Okay. And the reason why I asked the last 5 or 6 weeks is obviously some of those schools started 5 or 6 weeks ago. So it's important to, although I know, ask the questions how you're going to use the masks, how you're going to utilize the buses. We actually already have a small sample size in a way of some of those schools that are actually utilizing the masks, the social distances, the hand washing as you talked about, the buses. And I think they've been successful so far. Because we haven't had that outbreak. But more importantly, because I think the parents are also showing the children what to do. So I think teaching goes a long way, but if you look at the data, I think you can see that we've been successful last several weeks.
And can I make the statement too, though, that our kids have not been in school yet, so the data is the way it is because they haven't been. So it's a little.
That's actually not true, Ms. Justice.
Well,
The reason why I
year
asked
round.
about some of those charter schools is in the private schools, they are face-to-face. So there are a number of kids that are actually going face-to-face right now, and there has not been that uptick.
I'm recognizing that. I'm just saying it's a very small percentage, so that really couldn't, overall data yet, use that statistically to see a change.
I think that the parents, after all these years, have figured out how important a teacher is and how important school is. And I think they will go the extra mile and make sure that the kids do what they're supposed to do. And then we'll have to take them when they get to school and make sure they do what they're supposed to do. We hadn't had a chance to prove what we can do. And I don't know why we're talking about A so much. I wouldn't be in favor of A at this point. I mean, that's like going from 0 to 100. I think we need to take some baby steps and get the kids in there and prove that we can take care of them and make things work.
Mr. Rivenbark, I think the reason why we're talking about A is that I'm not sure you're aware, but the governor actually made a suggestion that elementary children go back to school face-to-face. And correct me if I'm wrong, but I think he said,
David, he's running for
talk to me a little bit
governor.
about the social distancing, what the governor said. He said not, you didn't have to be 6 foot, but social distance where possible, I think is what some of the language that he used.
Yeah, he said we're appropriate, we're sort of,
Well, and looking at the Stronger Schools Toolkit, what it says for Plan A is minimal social distancing as possible. So, yes.
But any plan would be better.
which gives you leeway as to what that is. You know, we've been sticking
Yes.
with 6 feet, which is a sort of a magic number for us, but, you know, that's understandably because of classroom size. Now,
Right.
again, I go back to if you've got 25 children in a classroom, 15 to 25, can you meet that quote-unquote need?
Right.
It's flexibility.
Understand.
Mr.
Not
Ravenbark,
But
did you
the
have a
gov-
question?
But the governor also, up until last week, I mean, what he said Friday was just completely different from what he's been saying. And all of a sudden he says, okay, it's all right, y'all can go back. He's running for governor. That's why he did that.
That's a personal observation. Some
It
counties in
sure
the
is,
state,
Judy, it sure is.
some counties in this state are really experiencing very small numbers, and that's understandable because they're rural, they're a different environment. They're actually following the protocol, and it's working really well. I believe that was possibly the reason that he did that, because it only makes sense in those small counties.
And especially in those rural counties
Yeah.
where they're struggling with internet access too.
Exactly.
Virtual learning isn't an option for a lot of those students. And
Yep.
so
Correct.
if your numbers are low, your internet is sparse, and you're gonna be able to come back carefully, it makes sense.
Can I
In a
ask
county like New Hanover County, it's a
Can I-
little different.
Can I ask a question about the school nurses? We did have a few vacancies. Have we filled those vacancies?
We do not have all of them filled. We have 4 vacancies remaining, but they are actively interviewing and making offers. But our school nurses from other schools are meeting with those schools who don't have a nurse on staff right now to make sure they have things in place, along with my 2 school supervisors, making sure they have things in place for what they need when you do bring the children back, whether it's Plan B or whatnot.
Okay, so we have all the staff trained that would be dealing with the
Yes.
isolation stations? Okay.
Yes.
MEC STEP, they have been participatory for the past 6 months in our call center, so those school nurses have been,
Very well
I would
versed.
say, privy and privileged to be throughout throughout the COVID event, so absolutely.
So would there be, I think there was some mention that there would be somebody that would be able to step in so that there would not be a school that would be left without a nurse?
Without,
Yes.
So you would provide nurses for those schools that can't currently don't have them on staff?
That is our plan, like I
Okay.
said. And as you know, when we hire someone, we can't get them on immediately. We have, protocols we have to follow. But yes, they are working so amazingly hard to get those staffed. Like I said, as of last week, we had 4 vacancies, but I know they were actively interviewing last week as well. They're actively taking applications. It's just an open application process. So yes. And we also have one of our former school nurses who retired, has agreed to come back on part-time, so she can fill in wherever we need for her to.
Thank you.
we actually had a budget amendment this morning, Commissioners meeting, to actually,
For the Porter's next
for
school.
the Porter's Next School as well, so to make sure that obligation is taken care of.
And thank you, because that is a big concern. I'm glad to
Absolutely.
hear that.
Yes, ma'am.
It is certainly a primary goal of ours to make sure that those positions stay full. And if you know, 3 years ago, we decided to go ahead, instead of piecemealing that, just go ahead and let's fill those positions at one time, and we were successful in doing that. So we thank you for your support on that as well.
Could you speak to the experience that you've had with New Hanover County schools throughout this process, just for the community that's tuning in to understand how involved you've been in the conversations, the work groups, and that, I think that would be really helpful.
From my experience, it has been phenomenal. Open lines of communication. Poor Julie probably got tired of me texting her on Saturdays, bless her heart. Our school nurses have been, even when the students were sent home last year, our school nurses stayed on staff. They were still able to work with their schools. They were able to get in their schools as they needed to, communicate with their staff. All summer long, we have had things in place. Our school supervisors, Maria Turnley and Susan Brown, have done a phenomenal job at working with central office staff to make sure that these schools have what they need with the toolkit to move forward. And like I said, since our nurses came back on August 11th, they've been knee-deep in the schools. I've served on a work group for months now that meets every 1 or 2 weeks. Trying to think what else. So just the lines of communication. If we have a question, we call and we get an answer. And if central office has a question, they call and we find their answer for them. So we have had a great relationship. Our success is dependent on your success. We want to keep these children safe, and so we've done everything we can to put the measures in place to make that happen.
Thank you very much for your partnership.
Sure.
Absolutely.
Yeah, and I would echo, even the fact that we had our preliminary meeting a week ago, and this was a primary discussion, right off the bat with new superintendent. So it's been a very successful opportunity. Way back from last school year, speaking of a student this year, I had a graduate from last year. Very disruptive senior year, but it turned out to be pretty cool. Still costing me in college, so you guys didn't really do a benefit to offset that. But the fact was, we have been in constant communication with the school system from day one on this event, and appreciate the opportunity with Dr. Faust last 2 weeks ago, and Julie really having conversations. So the proactivity is there. I can assure you of that. The conversation is there. And as Carla said, with therapists and also with nursing staff, we're in it with you. And she said, where our success is your success, that's where we are.
And I would like to point, I'm glad you mentioned the mental health therapists.
Yes.
We cover 21 of your schools with mental health therapists. And they have worked all summer long. They've been able to do telehealth, so they've been able to continue to meet with children and their families. And so we are certainly prepared when the students do return to school that there is going to be a level of anxiety. And those therapists are prepared to continue to bring on new clients as needed to help allay that as best we can in the school system. So we are very blessed that we're able to put those folks in your schools to help your students.
Yeah.
Can I ask you just kind of an off-topic question, still related to schools? We've talked a lot about COVID and about the risks that children have with COVID, but we also talked a little bit about, you brought up mental health. One of the statistics that I heard was that the amount of child abuse claims has gone down, but domestic violence has gone way up. What is that attributable to, one? And then two, since we've kept our kids out of school for now 6.5 months, from a public health perspective, what are you worried about the ramifications about these children not being in school? I know you talked a little bit about socially, but there are a lot of other concerns that we haven't talked about. And can you kind of expand on those a little bit?
Well, I can at least start with the children, and we can talk about the abuse side. And I want to go back to the isolation. I can see that with the older adult population, having a mother that's socially isolated for 6 months in a facility. I've watched that connectivity certainly go down. I've watched the mental capacity, if you will, without the proper terminology, go down. That was our biggest concern, particularly with students doing the same thing. And the younger ages. I can only speak to my daughter, who's probably not listening, but I will call her out. They live on their telephone. She works and she does. But the younger ones, obviously, we're concerned, particularly about that connectivity. The other issues I think we've seen within, particularly school-age children, is maybe the concern that, maybe they fall behind 2 or 3 months, or they're not connecting to a specific, as my sister said, who's a teacher in Charlotte-Mecklenburg, they're not connecting to an educational regime that they would get accustomed to at an early age. As we talked about this morning, Dr. Faust, I appreciate that. We're going to get back to that. So I don't know if it's as much a concern on the public health side, if we can get them back to some, and we had a conversation. We would certainly say, and let me back up a little bit. Very candidly, I don't think we ever said that we don't want an opportunity to get back into a school routine. It's just which one do we get into. So I want to put that out there as well. But again, for us, it's that connectivity. For us, it's the opportunity to learn at an early age. Also, the nutritional factors. But I will tell you, the school system has done a fantastic job of ensuring that those kids are fed. That was one of our biggest concerns, was ensuring some nutritional value. So I don't know that we have other concerns at the moment, but having worked with them on food and nutrition, having worked about trying to figure out the social isolation, working about how do we get kids back to school, I think those are the 3 biggest things that were on our mind, simply because those vulnerable young kids. The middle school, high school, they've adapted. The K through 5, for us, we want to get them back. We want to get them back.
And as far, and I'm not the DSS expert, so I would certainly want to reach out to my DSS counterparts as far as those averages. I would say, though, that I don't want to say don't put a lot of stock in that, but don't put a lot of stock in the lower child abuse, because if you think about it, I won't say a lot. I'm looking at Tufan. We have a proportion of our reports that come from the school system. If the kids aren't in school,
And that was the
we're
point,
not
I think,
seeing
yeah,
it.
yeah.
Therefore, I don't think that those numbers are as accurate as they could
Unreported,
be.
I would say, most likely.
Unreported, that's correct.
Yes, yes. So, and as far as domestic violence, if you think about it, if you already have issues at home amongst family members, and then you're told you can't leave your house, or you shouldn't leave your house, and then you can't go to work, and you have all the social issues and economic issues that go with that, then I would, my assumption would be that those things are going to rise the stress level to a point where potentially you do have increases. I do know that our DSS counterparts have shared that we have seen an increase in those reports. From a school system standpoint, I think about there are those children in our community where their 6 to 7 hours at school are the most stable hours of their day. And they don't have that right now. I think about community groups. My church, for instance, is right beside New Hanover High School. We reach out, we partner with New Hanover High School for those students. We partner with Snipes Elementary for those students. It's not something we can do a lot of right now because the kids aren't in school. So I just think there's so many benefits that we're not able to take advantage of right now.
But that's a result of COVID. That's not a result of the school system itself.
No, ma'am, I'm just saying the fact that we cannot, yeah, exactly. No, if I imply that, I apologize.
Right.
That's not what I'm saying.
Because, I mean, the truth is that there could have been things done earlier by leadership, not necessarily here, that would not be putting us in the position that we're in now. So, you know, please don't blame the schools for what's going on at the moment, because we're working the best we can to try to take care of all of our kids.
Like we said, you've done an amazing job of partnering with us in public health to keep your students as safe as you can.
Yeah,
And I
thank you.
would say, you know, even Dr. Faust, this morning we were talking about, and I'm sorry I keep throwing your name out here. But, you know, one of the priorities this morning was making sure that progresses and actually is enhanced. So thank you for bringing that up. As a public health official, with all three of us standing here, those are the opportunities for social determinants that we really want to be part of, and we want to make sure that we don't just talk this social issue and this equity issue, that we are a partner and we move it forward. We've talked about it for years, and we've had the same conversation for years. How do we collectively make it happen? And I think we certainly are a partner and want to do that.
Well, that will be a good outcome eventually, is the fact that we have learned to work together in ways we never thought
Absolutely.
before. And a lot of creativity's come out of this process. I mean, that's the upside, if you can think of an upside at all to any of this.
I think, Mr. Wortman, do you have a question?
You brought up a good point about your church next to Hanover High School. I'm not sure if we go to the same church, but my church also is next to Hanover High School. But one of the
We should know that if we go
one
to
of
the same
the
church.
one of the things that we're doing is allowing CIS into our gym, allowing a lot of these the community and schools, allowing them to use our gymnasium. One thing that we've seen are daycares are packed, preschools are packed, and that is new. As people are allowed to go back to work, they're looking for a place for their children. And again, that gets back to my point that you have these young kids that are there. We talked about K-5, which was specifically mentioned by the governor. And I think there's a reason why K-5, because as you said, middle school and high schoolers more easily adapt to.
Have assimilation already, yeah.
I have a Kindergartner, and he looks at a screen for 30 seconds, and then he's finding the next stick to throw. So we have a good data point where we can see that we have a lot of kids that have gone back to school, preschool, communities and schools, as we talked about. So we have that evidence that shows that we can do it. We can do it safely because there has not been that spike that I asked you about. So that's kind of the point that I was trying to make, that we have a small sample size. And it's not as small as we might think, because there are a lot of kids out there.
So let's, go ahead. Are there any other questions? Because that sounds like we're talking about AB models and whatnot.
Yeah,
so
I do have one more question. I think people,
As I do.
I think people do well with a benchmark, and I know, Dr. Fauci always says that the virus decides the timeline. And, who knows what the next 3 to 4 months looks like with flu season and all that, but is there a point, what does the toolkit say? At what point is it safe for schools to seriously consider opening under Plan A? Is it a 5% positivity rate? Is it a 3% positivity rate?
I would be honest, there was no magic bullet. There was no turning point. I know, and this has nothing to do with you, I know with UNCW, we put together 7 of those particulars. I don't know there was one particularly within that plan. You know, the idea was that, well, we've taken a stance to go to an approach where we're distancing and we're going to ease our way into this and move to this versus going to A or as she said, topsoil going from this point to this point. There was nothing there. It was just left up to the local to make that decision. Again, back to a suggestion. There was no magic number.
Okay.
There was no magic number.
Mr. Tar? Mr.
Doesn't
Tar?
help you, but it's just no magic number. Yes, sir.
I read an article the other day that they were talking about if we do all the things that we're supposed to do with washing our hands, wearing a mask, staying 6 feet apart, that flu season might not be as bad as it has in the past.
So there have been reports, well, which is ironic because these are the same things we talk about with flu. We've done it for decades, where flu season might not be as bad. Absolutely, where individuals are doing exactly what they're supposed to do. One of our other concerns as well on that is that we talk about flu, but we also have pneumonia and we're talking about lung issues. So, you know, just the simple fact that we've gotten to a new norm seems to be moving in an advancement of public health. It is inconvenient. I can't stand it myself. It's just, it's where we are. But yeah, there have been reports, particularly around the world, where it has curbed some of those other viral conditions, bacterial illnesses that are spread through, you know, droplets, et cetera. So you're absolutely correct. I think one of our concerns moving forward, as Carl had mentioned, was with flu season coming up, and you mentioned about flu season, that there are going to be these co-issues, and there has been no evidence that you cannot contract both of these at the same time, as she said. And there's nothing to certainly say that with an exacerbation of that with pneumonias that you can't carry them both as well. So there's, I would say there's some unknown coming forward. So as much as we can curb, I think collectively in our community, as well as other communities, to at least prevent the spread of one of these conditions, the better off we can be.
Thank you very much. Are
Thank you,
there
sir.
any other
I'd
questions?
like to ask, when do you anticipate starting the vaccines for the flu?
Sure, sir.
What, flu vaccine or COVID vaccine, Ms. Nichols? Flu?
The flu vaccine.
We,
I got mine
we
today.
are in the process, our school supervisors and our outreach team will work with the school system to determine when we can begin offering it. We have to get enough on board. We're waiting for our shipments. The big box stores, CVS, Walgreens, those places tend to get their shipments because they're larger. The hospital has gotten a lot of their shipments in. We right now have just under 400 doses in stock, and so we want to make sure we have enough to accommodate the need before we begin offering it. So we will reach out to the schools. We're hoping to get about 1,500 additional doses in the next couple of weeks so that we can get that scheduled. Our plan is to let our school nurses offer it and provide it to your staff members at every school. And like I said, when the students do come back, we'll work on a schedule on how our school nurses can work with some of our UNCW student nurses and our other nurses to provide that to the students in the middle and high schools who want to have it, whose parents want them to have it.
1,500 really doesn't
Yeah,
seem
and that's going to
Well,
take
we're
a
waiting,
lot of,
we've ordered 4,300. We want to have about 1,500 on board before we begin offering it to the community because we don't want to offer it and then run out. So yes, ma'am.
and that's going to take a lot of planning as well, of how we're going to administer for our staff.
We've done this for probably the last 5 or 6 years, so we're just going to
But they
just
weren't all
repeat the
in,
model.
they're not all in the building right now, so
We will certainly have something in place.
And they're being
I'm sure you
offered. I
will.
think-
Thank you.
I went to pick up a prescription yesterday, and Walmart was asking every person. in
Are
line.
they, good, that's good. I see the signs at CVS. So yes, it's available in a lot of places already, and we would encourage people to go ahead and get it. Don't wait until we come into the schools. If you can get it somewhere else, please go ahead and get it. It takes 2 weeks to get full immunity from your flu shot.
Thank you for that information.
Yes.
I mean, for us in public health, we're an assurance model. So if you can provide it, fact is, we want to make sure it's done. It is all about an immunity within our,
Yeah, we don't have to do it, we just want to be able to assure that it's
yeah,
happening.
we call it herd immunity. But if, our assurance is you get it where you can. And I will plug, if I may, the other immunizations, particularly that we might offer particularly teachers. You have a lot of young teachers in there, that we take every opportunity to do that as well when we get when we get those chances. So, yeah, we'll partner with you at any way, or at least make sure that referrals are places where they need to be.
Thank you so much for being here, Ms. Thomas, Ms. Turner, Mr. Tart. We appreciate this information's been enlightening and very helpful. Are there any other comments or questions, concerns before we move on?
I do want to say, Ms. Bradley has reminded me, we are actively working nationally and state level and locally on our COVID vaccination plan. When a COVID vaccine becomes available. Now, there is not a COVID vaccine in development right now for children under 18. Not that that's not going to come down the line, but we are from 18 and over. We are working on our plans right now as to how we're going to be able to bring that to the community when it becomes available. So we want you to know that.
Thank you.
And we'll certainly work with the school systems on that too, for the faculty and staff.
Thank you very much. Thank you so much for your time. We appreciate
I
you.
really do.
Thank
Next
you.
time you
Thanks,
come, bring us a
guys.
sticker, please.
Say that again.
I said, next time you come, give us a sticker. Lollipop, see the dog.
We've got the, I'll bring a roll.
Thank you. Appreciate your service. Thank you.
All right. That leads us to the next item on our agenda, which is old business, 2020-21 school opening update. And I am going to throw this to Dr. Faust. But before I do just want to say this. Last week we met on Tuesday. And Tuesday evening, we made the vote to move to B. And none of us up here knew about the announcement that was going to come 2 days later. And we know that Governor Cooper's announcement has thrown this community into a flurry of panic. And I get it. We want to have an open dialogue this evening. As we heard from the health department, we will see where we go from here. But, we understand that everyone is feeling really fearful. Whether you have a child in school, whether you are a staff member in a school, a teacher in a school, there's a lot of fear in our community right now. It might be about losing a job. It might be not be able to eat. It might be that you're afraid of getting sick. Fear breeds anger. Anger breeds a lot of uncomfortable conversations. And I'm going to ask, as we move forward with these discussions, we need to find some civility. It's been really hard to watch people attacking each other on social media. It's been hard to see people feeling teachers versus parents, and we all want the same thing. We all want our kids to be in school. We know that's the best place for them, but we also know that there are factors at play here. And so keeping that in mind, understanding that we're all angry, our lives all changed last March, and we're all trying to get through it. And if we're going to get through it, we have to do it together. And I appreciate Dr. Faust's leadership, senior staff. They have been working around the clock to look at options. They are having conversations at all levels. And so I just wanted to say that before we get into this conversation, and just appreciate everybody that has spoken up, no matter what side of the fence you're on. And there's multiple sides of the fence. Whatever side you're on, we appreciate you speaking up and sharing your thoughts. We are listening to you. This is just a very, very complex discussion, but all of your voices do matter.
Ms. Adams, can I say one thing?
Yeah.
You said a lot about fear, and obviously back in March when everything was shut down and we had something that we never had before, we all had to make changes, and there was some fear as to how we're going to move forward. But I guess I see the community a little bit different right now instead of having all this fear out there. I think that regardless of who you're talking to, whether it be someone who's for Plan C, whether it's someone for Plan B, or someone who's for Plan A, I see the excitement because they actually see the innovation that we've had in the last 7 months. and the strides that we are, last week, we actually, again, I was the lone dissent vote, but we decided to move from C to B. So we actually made progress. So I don't think it's necessarily accurate to say that everyone's fearful. I think that there's a lot of people out there that are excited that we're beginning these conversations and that we may be able to get our kids back in school. We may differ, we all may differ about when our kids go back to school. Everyone knows where I stand with that. And again, I know where everyone else stands. But I think it's more of, it's not fear, it's more of looking at what's coming, and soon we may actually get back to normal.
I think that's a very fair statement, and you're right. A lot of great opportunities have come out of this as well. So thank you for bringing that up. All right, Dr. Faust.
Okay. So I would like to first start off with our team watched, as everyone else watched on Thursday, as the governor had made their plan. And we have not made a plan for A. That's not a plan where we had gone as a school district as looking at senior staff. That's not the plan that we were actually thinking of. That's not where when we left here on Tuesday, we were in a model of under Plan B with a group 1, 2, or 3, and then we were asked to examine an A-B model. So we went back to the table and looked at several models and met with curriculum and instruction on looking at how to impose a flipped classroom model. That model would provide our teachers the opportunity to use the instruction technology in small groups while the remote learning, and so that it's not actually teaching remote and well, it's a spinoff, I'll say, from, they're not necessarily teaching the remote and the face-to-face simultaneously. They are doing some other sessions that are in between. So that's what we looked into, and we looked at it from an AABB model. We spoke with transportation, and currently because the principals had gone through and put the students together in a plan of Group A, Group B, Group C, we would then have to go back and look at Group C and then divide Group C into a model of putting those students into Group A or Group B, which along the lines takes a little bit of time. So we are working through that process also to see what would that look like. We know that currently we would have to put only 24 students on a bus to keep them socially distanced. I think the word was, if my numbers are correct, it's on any given day minus COVID, we could fit 72 elementary students on a bus. So then we're now putting 24 on a bus, so you can see what that would look like to socially distance. We would then, we went through what does it look like, and I'll reiterate, PPEs are in the building. There was not an actual need to, I'm assuming, give them to teachers because there are no students in the classrooms right now, but PPEs are in the building. So there's no worry about are they able to have the supplies that are needed for students. We are then, of course, looking at, the big one is the curriculum and instruction piece. So today we looked at how would we roll out this plan? When would it take place? What should the plan of professional development look like? So if we were to go down the road of an AABB model, we would then have to pull people in, train them on the flipped classroom, and then we would ask that we could possibly get that done and have students in an AABB model with remote learning on Wednesdays by October 12th. The reason why we would need October 12th is because if we go that route, we have to redo the transportation. If we were to stay in the model that we are in, where it's without the flipped classroom, we're ready to rock and roll now. But we have to rearrange, we have to do some training for teachers in a flipped model. So that's where we are at this point.
For the non-educators, can you explain what a flipped classroom is, please?
So why don't I ask Dr. Smith to come up, and because it's a new model, we are doing the flipped classroom based on the New Hanover County Schools model.
So good evening to you all, and I don't have my notes in front of me, so hopefully I won't get this too far off the mark. But essentially, what would happen is that we would be offering instruction concurrently. We're looking at a model where the thinking about the Bloom's taxonomy, we understand that there is a continuum where essentially students at first are acquiring new information. They're handling it in terms of recall and more or less the knowledge level. So those types of presentations would be developed more so for our students who are remote learning. And then the other end of the Bloom's taxonomy is when you see application, synthesis, and evaluation. And so at that point, you would have students who would be engaged in more project-based learning, more hands-on types of activities, that deeper level of an understanding. We would continue using our current curriculum materials, and specifically speaking to Open Up Math and our middle schools, it really lends itself to that because there is a lot of questioning that's a part of that curriculum where we're asking children to be involved in investigations. And so we would be supporting both models in a concurrent manner, but the expectations would be slightly different in terms of the acquisition of knowledge and the application at the same time. We met with our instructional team, as Dr. Faust shared today. They presented an overview and understand this is a plan that we developed really just based on the information that we heard from the governor on Friday and moved to this transition. But we are planning on meeting with our principals tomorrow to overview it with them, and then we will actually have exemplars that we will be able to share with our teachers later this week. Our instructional team members are working to create some model lessons and some recordings that we can use as exemplars with them.
Can I ask a question?
Yes, sir.
Can you explain exactly, so synchronous learning will be provided for students who don't do the virtual academy but also opt to stay remote?
So if we're in Plan B, there will be where we are right now is there will be the opportunity for synchronous instruction. It will look different than it does right now, but we would work to continue to provide those opportunities for our students who are remote. It just would look very different.
Do you know how it would look yet?
Say again?
I said, do you know how it would look yet? Could you sort of take me through a day as a remote student?
Well, what I would say is once we have those model lessons, then we can actually show you what it would look like.
Okay.
But what we don't want for our students who are coming face-to-face is for them to simply be doing what they would have been doing at home on remote. So we want to make sure that the level of engagement, because they are physically present, is very high. We want to make sure there's opportunity for them to interact with their teachers and to interact with their peers. We also think that this is a great opportunity to build back what we've lost in terms of those social interactions, and so we want to maximize those at that time. But yes, we would have those those exemplars available later on this week.
Great, thank you very much.
Yes, sir. Dr. Faust, you actually turned it over to Dr. Smith, but I did want to ask you, so what you're saying is that you're looking at the possibility of putting an A-B-B schedule together, which to people that aren't quite sure what's going on, it'd be very similar to the A-B that they're talking about in other counties, except in a different format with different amounts of students. Is that a good way of putting it?
So the students who are in Group A would come on Monday and Tuesday.
Yeah. Mm-hmm.
And then on Thursday, Friday, you'd have your Bs.
So it'd be a split week. Instead of 1 week, you'd have, and 2 weeks off, you'd have a split week for all students.
Absolutely.
Okay, so, and you're aiming at the 12th as a possibility to present it to us?
We would at the I think there's an October board meeting.
Okay. And in the meantime, we would start off on the 6th doing the
You would
current model.
continue, yes.
Right. Now, if we're going to be doing all of this, and once you present it, what about teacher training? You did mention teacher training. How much opportunity are they going to have to convert what they're planning on now with the Plan B, the one we're currently going to be using, to the model that you're possibly going to be in front of us? Because a lot of this has to do with training and planning, and I don't want the teachers to get overloaded. I'm amazed at what they've done since last spring. But, I mean, they're human beings, and the pressure is incredible on them. So what can we do, put in place to help them transition until now, even another idea if we have to?
Well, I think, sorry, not to interrupt, but I think that was, and that's was going to be my question with the flipped classroom model. I mean, that's one thing that we heard this week when we talked to the Teachers Alliance, is that the burden right now is very high, and that wasn't really going to drop. That was going to get higher, get worse when we went to the hybrid. So does the flipped classroom model help take some of that pressure off?
So what I would say with that is there is the opportunity to create these model lessons that could be used across different teachers' classrooms. As you know, our schools are structured slightly different in terms of student numbers, so we have different numbers of teachers. But there would be the possibility that, for instance, maybe the math teacher creates this particular lesson that is then delivered on demand, or they structure that, excuse me, and even though it is delivered face-to-face, it's someone else who's designing that. And then, again, we're not using different curriculums. We're using the curriculums that are already available to us. So we're using our foundations in K2 to teach phonics and reading skills. We're also using our reading and writing fundamentals in our elementary schools, as well as our reading fundamentals in our middle school, along with our open up math curriculum. So we are standardizing around those particular curriculums. Excuse me. So it's materials that teachers are familiar with. It's just going to be that the design and delivery would look slightly different for them.
So just to clarify, every child, every family that chooses to go into school is going to be in school at least 2 days every week under this model. And we still have virtual academy is occurring, and then those that are not feeling comfortable to go back into the building under B, are they able to continue remote at home?
So there has been no discussion under Plan B to eliminate the remote option for families.
What would happen if we went to A with that remote option?
Well, I am just very much speculating. I do not see a way forward that we could continue with that. I think that burden would be far too great on our teachers. Now, of course, I am not the sole decision maker in that, but the conversations that I've been a part of do not lend themselves to there being an option once we are in Plan A.
Got it. Thank you.
So will we ever go back to Plan A then?
Say again?
Will we ever go back to Plan A if we're not going to have that remote option? If you're saying that the burden is too great if we were to move to Plan A for K through 5, and that there would never be a remote option other than the virtual academy, is that correct?
What I'm saying is the conversations I've been a part of thus far, there has not been the discussion that makes a way forward for the remote instruction to continue while teachers are teaching face-to-face the overall majority of their students. But I don't think that precludes us in any way, excuse me, from making the decision to go to Plan A.
Okay. So, and that really is dependent on how many kids actually come back under Plan A. Because you can't make that decision, because let's say you only have 50% of the kids that come back, then you would have the ability to use some of those teachers for remote learning, correct?
So let me answer. So to answer your original question, in order for us to move to Plan A, we'd have to talk with the health department and get a blessing from them.
So we are not, just to be clear, we are not even considering Plan A, correct?
No, we're not considering Plan A.
When will we consider Plan A?
When the health department gives us the go-ahead.
Well, the health department didn't tell us that we couldn't or couldn't do it. They said that was not his job. The health department gave us statistics as to what was going on in the community. The governor then got up, and I understand that we can say what we want about why he said it, but standing right next to a physician said that he thought that it was, didn't tell us to, but that going from K5 full-time was an option. So I understand what you're saying, But I don't think the health department is going to come in, correct me if I'm wrong, Dr. Tart, I don't think the health department's going to come in and say, you need to go to Plan A now. Am I correct? Yeah, he's going to give us the statistics in Hanover County, and then we're going to make the decision. So that's why when we're not even considering a Plan A, especially given the fact that it was tailored towards a K-5 model, which I think we can all agree face-to-face instruction is probably most important for K-5, because middle schools and high schools.
For all students instruction.
Well, they specifically mentioned K-5.
But I would also go back and, I would argue that instruction is important K-12.
100%.
And even though they said K-5, I disagree with the governor saying that, just based on the instructional. I believe I'm an educational expert. I'm not sure what his background is, but I know that instruction is even more so needed at the middle and high school level, just as it is in the elementary level. So I can't make a case that will say that, oh, it's better for us to go at the elementary level. That's not my recommendation. I can't make that recommendation because I don't understand why we would say, I don't understand why we would say K-5 and not K-12.
And I understand what you're saying. However, legally, the only kids that we can send back to school right now is K-5. On a face-to-face plan based on what the governor said. He did not address middle school or high school. So we can't, at this point, we can't send the middle school and high school. So that's the reason why I'm talking about K-5, because he actually gave us the opportunity to talk
You mean
about K-5.
hybrid?
Excuse me?
We can send them back in hybrid.
Right.
K-5, middle school, high school.
Oh, that's correct.
Yes, under a Plan B, yes, that's correct. But we can't do the full-time face-to-face that he talked about.
I definitely understand people's desire to get back. I have it too. Based on the numbers that the health department laid out, I mean, personally, I'm not going to consider it. Not today, so.
Well, I hope at some point, Nelson, you
Of
will
course I
consider
will.
it.
Of course I will.
Because I think that's your job. And we've talked about, this,
I've
the
considered
reason
it.
why we do, the governor said was for these rural counties to do it. And that's not necessarily accurate, because just today, Harnett County, who has a student population of 20,000 kids, decided to send their K-5 back to school.
Yeah, it's
So
easier-
there are different reasons.
I think it's easier to ramp up than it is to pull back.
What I think about is, some of our classrooms, we have 27 to 30 kids in them, right? I cannot imagine putting a teacher in a room with 27 to 30 students and for them to feel safe.
But again, and I understand that if we were to put 27 to 30 kids into a classroom, but we are talking about K-5 right now, and
But that's
there's classroom requirements from K through 3 and 4-5.
K2.
And then you can also look at this other space to space children out in those schools, and that's what Mr. Anderson and we talked originally in July about how many kids you actually can get into a building utilizing your cafeteria space, utilizing some of that. So
But
I
you don't
think
have the teachers, though.
Right.
If you're spreading the classroom out, now where are you filling those educator gaps?
if you were to spread a classroom out into a bigger classroom,
Oh, okay. So
and
you're
then
saying.
we don't know how, and again, I don't know if we know if there's going to be 100% participation, because I think
True.
we talked about 65%, I think, is the one that wanted to go back full-time face-to-face. So I'm not, obviously, I'm for Plan A. I'm
Right.
giving parents the choice. I'm not telling kids to go back to school. But by not even considering it, I think we're going to, again, get into the same position where we were when we voted in July, when we voted 6-1 to go for the first 8 weeks, and it was impressed upon everyone, oh, we're going to try to do the best we can to get back early, and we didn't. And now, without looking at Plan A, and if we're going to go to an AABB model, without even looking at Plan A, we're not going to be prepared. If at some point we decide to do it, let's do it. So at least we have those plans kind of moving forward.
And I think that's the thought, to be able to look at it in the future. But based on what I heard this evening, and I'll use the analogy, and, Mr. Tart said this to me, or Dr. Tart said this to me, we don't put kindergarten children in a calculus class. Going from C to A is such a large jump, and that's not what we've been preparing for. They've been looking at B options all along. And so to make that jump seems excessive and rushed and dangerous.
Especially with our youngest students who don't even know the new normal. So I think before they get back into the classroom at all, they need to know how to get back safely. And our teachers need to know what those expectations are and how to do it. And they know that we're doing this safely. They need to know that we have the PPEs. They need to know that the students are going to come back correctly. The staff needs to know how to, the custodians need to know how to clean the building. We need to know that we can do this.
We already have schools that are doing that.
Stephanie?
We have not done it
We
yet.
haven't done it.
And we've got to
We
give
need to
our
do it
schools
now.
the opportunity to see what it's going to be like when you have 100 students waiting to come into your building and you're doing your temperature checks and you're doing your screenings. We need to see how that works before we could think about moving forward, in my opinion.
Yeah, and I appreciate the fact that we are flexible. I mean, we're now looking at this AABB schedule, which honestly, remember the last meeting, David, I like the idea of the kids coming.
At least we're doing
for
something.
a couple
yeah.
days a week, even though I know the logistics can be a nightmare, and they will be until it's settled. But, but still, the numbers are what they are, and they aren't stabilizing, they're not going down, they're still going up.
He just said that, with all due respect, Ms. Justice, don't let the facts get in the way of a good story. He actually just said that the numbers were actually trending down recently, so let's not.
For 2 days.
I understand that, but let's not just say that all of a sudden this is going rampant, because that's not true.
Can we go back to the presentation and ask, so do we need to, if we took a vote to go to Plan B last week, do we need to go back and take a vote to, if we are seriously considering the AABB model, but pushing it back a week, would that require a vote tonight, or would you prefer to wait until you've had a chance to check in with the principals?
I would like for us to have a vote so that we could go ahead and not have to come back and,
That's a good idea.
we would just know we would go ahead and move to that model.
Okay.
Good.
So the choices before us seem to be either staying with the 1 weekend, 2 week off and starting on the 6th, or delaying a week but going to the AABB model. The delay would be mainly because of transportation. So you
Or
feel
Plan
like-
A as well. That
Pardon?
can also be before us as well.
I'm sorry?
Plan A would also be before us as well.
I mean, if you want to put that motion before us.
Well, I think,
up to you.
we should note too, that when we voted on Plan B, Plan B was the only option, and because of our schools, the size, we had to do it in the 3 cohorts, right? That was why. By the governor opening to Plan A, it actually opened the availability to go into 2 cohorts instead of 3, size-wise.
How did what the governor said change?
Doesn't it
the size?
allow larger
We could have
for
done
social
we
distancing?
could have done the AB, Dr. Faust, we could have done voted and approved the AB model last week, correct? Because Pender County had already done it and Brunswick County had already done it, so they were already doing it. So clearly we could have done it, correct?
So what we didn't know is, what the board, I'll go back, what to my understanding, what the board had already voted on is the Plan B under the 1 weekend, 2 weeks out. So that's what we had planned to do. There had not been any planning under.
But there were no restrictions of going to the AB model last week, correct?
The only restrictions that.
You hadn't planned for it.
We hadn't planned for it, and the transportation was not ready for it.
The governor, the legality, what he said didn't affect the ability to whatever Plan B model is.
All right, well, that's my mistake. Okay.
Well, I
then-
appreciate
Yes,
Madam
ma'am.
Chair, I appreciate the fact that we're having the opportunity to go into the split classroom situation. It makes a lot more sense, and if it takes another week to get ready, but I know from talking to teachers and reading the emails and the administrators, they're ready. Whatever we propose, they're going to be ready for these children. So we just want to make sure that we've got everything in place and answer as many questions as we possibly can for these parents, and to assure them that we're doing the best we can.
And I'd like to say something. I've talked to the administrators as well, and everyone I talked to said, we've been getting ready for this for 2 or 3 weeks. We want our kids back, but we can't take them back like drinking out of a fire hydrant. We got to take baby steps and get back right. And I think if we can do this and prove to everybody that we can do it the right way, then we can jump right into A.
I think the other thing I would ask too is that we make sure that, especially for our older schools, that we've talked a lot about PPEs in the buildings, but we need to make sure that in each classroom we've got the availability of PPEs and the hand sanitizers and the things that we had talked about. So just if we can go through classroom by classroom, because I have talked to some teachers that said that, some of either the sinks don't work or we don't have the hand sanitizer stations that we've talked about. So especially for our older buildings, just to make sure that we do have the coverage that we said we would. So,
Sorry, piggybacking off that, Ms. Step, with devices, are we good there? I want to make sure that every device is available that needs to be. Some students have said that there's a limit, but are we good on devices? Are we 100% good to go?
Yes, we have devices, as soon as schools ask us for additional devices, we have them.
Okay, but do they all have cameras?
Do all the student devices have cameras? No,
They don't?
no. We've got more ordered,
Okay,
and we've got some more iPads that came in, so we can switch out some devices if need be. As a rule, in the past, we had not over the past several years been buying cameras on student all the iPads do though.
okay, and there are more coming?
The iPads are here, we just have to get them accepted from purchasing, so that way we can reach out to our elementary schools that have laptops for fourth and fifth grade students. We can switch them out if they want us to. Some don't want us to because the kids have liked the laptop and prefer the laptop, then that'll be fine, they can keep that. We do have more laptops coming, and they should be here, I got the list within, initially it was supposed to be this month, but now they've pushed it back to, next month.
Thank you,
As we get them, we will let schools know as well.
thank you very much.
And while we're on the topic of devices, there's things, I'm getting some mixed signals from different people and this is parents, as far as what the situation is going to be when we do bring the devices. That some schools have one way of saying leaving them home and the other ones say bring them. So if we can get some consistency across schools about how we handle that, that would probably really clear up a lot of confusion that's going on about, devices in the schools and devices at home.
Yes, we have told the schools, and I'll continue to tell the schools, that students can bring the devices that they've checked out back to school or their personal device if they choose to school, but they're not to require the students to bring them to the school.
Okay.
Because parents sign a form taking responsibility for them. Some parents might not be comfortable with a kid touring them back and forth. So it'll be up to them. They can ask them to, but they can't, make it a requirement.
And this is very unusual circumstances.
Yes.
In the past, we discouraged kids from bringing pricey items to school for various reasons. We are not into normal circumstances.
Yes.
So I would think that these devices, if they're going back and forth because of the smaller grouping, they should be able to be monitored a lot easier.
Yes. And then
With this-
if they bring,
with this-
for the students who
I'm
didn't
sorry.
check out devices, who had their own device, like my daughter, she didn't check one out because she had one, she'll be able to bring hers to school, and we'll have people that will help them get them on the network.
Thank you.
Ms. Brinson, those students who do not bring their device, will they be at a disadvantage?
No, they will not.
well, and correct me if I'm wrong, with the flipped classroom model, you won't necessarily need a device. Is that correct?
That is correct.
Okay.
That is correct. A lot of activities, we're encouraging them to do other activities, especially at the elementary level. Kids have been on devices for so many months, to give them the opportunity to have more interaction face-to-face and with the teacher. However, there are some required assessments that have to be done on the device and different things, so those they will definitely need the devices for.
I'm not sure who this should go to, and I don't know if it's necessarily a question, more as a process. We've received a lot of emails over the past couple days. A lot of them are from teachers, and teachers have shared some of their what their perceived lack of supplies or lack of access. And what if that's the case? If they are feeling going into this that they do not have something they need, whether it's from a safety perspective, a technology perspective, who should they be reaching out to get that conversation going? Because based on what we've heard from you, we have everything we need. So how does a teacher, a support staff person, a bus driver get what they need if they feel like they don't have at this time?
Their hiring manager.
Okay.
They need to first, so teachers go to your principals, bus drivers go to your supervisor.
Okay.
And we'll make, all schools make the same equipment available, because, I've been getting, emails and everything too, just like all of us have. And there seems to be a concern that some schools will allow some kind of PPE, and other ones don't have them available. Can we make sure that, and also instructions on how to use them properly, things like that, they can be consistent across all the schools,
I would assume, I don't know about I don't know what they'd be, that, I don't understand the question, I guess.
There's inconsistency from because teachers talk to teachers in other schools, and the way that they're receiving equipment and instructions how to use it appears to be, this is what I'm hearing, I'm surprised they haven't emailed some of, you also, that there's some inconsistency going on there.
So again, I think they should go back with at the school level, talk with the principal,
Okay.
so that the principal can give guidance on where the PPEs are, how to use the PPE, and that type of scenario. Because there will be different things that need to take place in different schools or different classrooms.
But there are some givens that everybody should have the same opportunity and instructions.
Yeah, and there's some videos coming out that communications has been working on the equipment for families and for teachers on how to use it.
So Dr. Fowles, our special need teachers, they're going to need additional protective equipment and clothing. Is that available for all of them and for every day that they're with the children?
Yes, for all of our teachers, and so special ed has taken that into consideration also.
Dr. Faust, will our faculty and staff be allowed in the building on Wednesday when it's supposed to be cleaned, or will they be working remotely on that day?
They will be in the building.
Okay.
Yes, same
And
schedule, just be a remote.
Okay.
Is that safe for them to be in the building when they're cleaning the building in a different capacity?
So what we've talked about is that allowing the principal to schedule times as to what classrooms, what floor. I think probably the head custodian would create a schedule for, in concert with the principal or the assistant, whomever's over the cleaning of the building.
Dr. Faust, can I ask a question?
Yes.
Understand we had the discussion about Plan A. We asked Dr. Tart about some metrics, about things that he talked about, what metrics he would look at to open the school up, back to a Plan A format. What metrics, because I think parents are going to want to know how we move forward. They're not going to want to be in the AAB model forever. They didn't want to be in Plan C forever.
Absolutely.
So we're moving to the B. What metrics are you looking at where you will either A, start to consider a Plan A, or B, I hate to use A and B again. So one's Plan A,
Right.
consider a Plan A, or two, actually go to a Plan A. What metrics are you looking at?
So this isn't an indefinite model. So
No, I
our
know.
goal is to get to Plan A where we are not having to do remote learning and all kids are going back to normal. However, we have to look at the numbers and then I will be having more conversations with health officials, the hospitals, to get some guidance on it. But it's not that, we will be sat here. The goal, hopefully, I can't control the spread of COVID, but if our numbers are coming down and they are consistent with that, then we need to be coming back and talking to the board and say, hey, I think we're ready to move into Plan A.
So understand, we don't know when the numbers are going to come down.
Right.
I think we were getting a better handle. I didn't ask Dr. Tart, but I think originally when this had, the death rate was a lot higher than it is now. So I would say the virus has maybe mutated into more, spreads maybe a little bit easier, but the actual seriousness of the virus, and correct me if I'm wrong, Dr. Tart, the seriousness of the virus is not what it was back when it was in March, when I think there was maybe 33% of the people that actually presented to the hospital were potentially dying back in the March. So that being said, if the numbers keep becoming in our favor, dropping, is it something that even though we're moving to the AABB model, potentially if we vote to do that, can we at least start the discussion on a Plan A and have Mr. Anderson start looking at transportation needs for a Plan A? Having principals look at their specific schools for social distancing. And let's focus, and I understand getting everyone back into school is important, but from a K-5 perspective, we hear that a lot. Get the K-5 back and get those kids back into school. So is it something we can at least start looking at social distancing, potentially bigger classrooms or cafeterias?
We would, so that would of course be facilities that we would look through that lens, but we would. The goal is to get kids back.
No.
And the reason why I say.
I just want to be ready, that's all. That's my biggest, I understand we all want to be.
And the reason why I say secondary, we have to understand that in the fall, well, in December, I think it's this time, we will be giving EOCs for English 2, biology, math 1, and I think maybe math 2, or I think that's, but that's why I'm saying it's important for all of them, because that's going to be the first layer, and they have not given us any leniency on EOC testing. So it's important for everyone to get there, but we have to put, the safety measures in place, but we will definitely be considering it. I'll be honest with you, it's easier to plan for A than B, C. It's because that's what you do on a daily basis, just the cleaning. It's just not something we can do right now, but we don't have to do a lot on the instructional side for.
I just want parents to know, and I understand that, but I want parents to know that we're not, because I feel like we kind of got stuck into a plan C. Nothing really happened for the 8 weeks. And then we're going to hit the 8 weeks, and then we started to do the plan B. I don't want to be stuck to the plan B. Again, things can happen. We don't know what's going to happen with COVID, if there's going to be a second wave. We're seeing that overseas right now, potentially doing some of that stuff. So just to be ready with a game plan. That's.
And I would say that our goal would be to bring a metrics back to the board to show. And then, of course, having, several conversations with the county officials. They can't get away that easy. We have to have them at more of our meetings. Not that they are getting away easy. I shouldn't have said that.
So if again the vote passes and we go to this AABB model, how are we going to get the word out to staff and parents that we're pushing this back a week? How is that going to work?
That'll be communications, and
because that's a pretty big deal that we are going to be pushing it back. So how is that message going to get out?
We'll start with a press release tonight that announces the decision that's made, and then we'll follow that tomorrow with communication across all of our channels, so all of our social media channels, our Connect 5, email and phone call, and then also follow up with all the media outlets to make sure they're accurately portraying the decisions that were made tonight.
Okay. Are we going to explain the why as well?
Absolutely.
Is it going to be okay?
Yes, and the ramifications as well in all the other facets of extracurricular and volunteers and visitors and those other implications as well.
And we're still going ahead with the town halls?
We are. Those are going to be an employee town hall on Monday, and then Tuesday through Thursday next week will be the community town halls. Thank you. I actually have one more, not to put Ms. Barnum on the spot, but Julie, could I have you come up here just for a second? I have a question. We received a lot of messages from parents talking about mask exemptions, and I know that you talked a lot about this last Tuesday. If you could just share what is considered a mask exemption, that would be very helpful.
Okay, absolutely. So, of course, we know from the toolkit, which I happen to have in my hand anyway. Sorry, I mean, I ride around with it, right? It fits in my wallet. We know that this requires that everybody in the school setting, K-12, including visitors, kids, adults, staff, are to wear a cloth face covering. And we also understand that there are going to be some folks that can't. So it says they're all required. But it also includes information like, well, it's saying that it's not appropriate for if you're eating or drinking, strenuously exercising, for anyone who, for medical or behavioral condition or disability, can't remove it themselves, has trouble breathing, unconscious, incapacitated, that kind of thing. So we know that there are going to be situations where we need to consider if a mask exception can be utilized while keeping everybody else in the setting safe as well. Because we worked with our legal partners, and Deborah Stagner was very helpful in this, and the Therrington Smith firm, in really digging through what this requirement means for us, but also how does that apply in situations related to students with special needs that have accommodations for a lot of self-care supports, but then, also for students that might have a physical disability and they can't remove it themselves. So we have to consider all these. So we based on legal guidance, created a mask exception process that asks for the medical or behavioral documentation or other. And we created for our principals a guidance flow chart thinking, maybe like what am I trying to think? A flow chart just for thinking through if you receive one of these, if it's a student or if it's a staff, and then I'm going to it in my head. And then with the medical documentation, are there ways that we can still safely accommodate with additional distancing, with potentially a face shield, which we know a shield and a cloth face mask are not equal in terms of protection for those in the setting. And so what could we do, whether we have clear partitions, whether we increase PPE of staff, and then look for, on a case-by-case basis, look for any option to keep folks safe. The problem is, and then before we determine that it can happen and that those folks can still be in the building, we have to go back to our school nurse to determine if it's safe and appropriate. One of the things that I was working with public health on today with the school nurse supervisors is if we have a child that can't wear a mask and that kid tests positive, it does clear out the staff for that classroom and anybody that's been working with them, because you can keep the 6 feet, but that's not enough if they're not wearing a mask. And so we will be creating contacts or exposures. So we have to weigh out how to really serve kids individually on a case-by-case basis on, where's the need here, because we'll be cleaning out, we'll be sending folks home.
The bottom line, unless there is a severe medical behavioral issue, parents are not able to get a mask exemption.
Yes.
Okay.
And they'll be few and far between. We'll have to really work out remote options for those.
Thank you.
Mostly.
And I appreciate that because I know that was kind of the last minute.
Yeah, thank you.
Ms. Barnum,
Yes, ma'am.
for a student who has the mask exemption, would the parent have to provide transportation for that child?
Thank you for mentioning that. On our guidance document, we know that any student that cannot wear the mask cannot be on the group transportation. So we would have to work on another transportation option, either asking the parents to do that or assisting them in another contract option. But they would not be able to ride a bus.
And I have another question about Wednesdays. Those students that are to come 5 days a week, how are you going to secure them while they are sanitizing the facility?
They would be 4 days a week, wouldn't they?
Right.
They would be 4.
Did you want me to respond to that, Dr. Fausto? So when we talked about the AABB schedule, AA remote BB option, we talked about needing to stick to, for those students with special needs and also our English language learners, really wanting to keep them on the same schedule as other students in the building. And so if Wednesday becomes a remote learning day, it needs to be a remote learning day for all students. Otherwise, you end up flipping their plans. So they have individualized plans, especially the students with disabilities. And if they are in the building and they don't have their typically developing peers or their general education peers, their IEPs, individualized education plans, can't be implemented accurately. And so we would want to make sure that they're only in the building those 4 days if we move to the 4 days of in-person.
Okay, that makes sense, and I appreciate that.
Okay.
Ms. Farnham, this might
Thank
not be
you.
a question for you, Dr. Faust, this could be for you. So teachers that have children, are we going to allow them to be, bring their children to school and go to school for those 4 days? How are we going to address that?
So the conversation is that those students, and maybe I think we talked about that, there have been so many conversations. What was the conversation? Oh my gosh.
Do you want me
You
to
can
talk
go
about
ahead and
the
answer
last
that
thing we
one.
covered
Go ahead.
today?
I've been in so many
So
meetings today.
we have the students of our staff in our remote learning labs right now. And we have discussed that we would want to keep the remote learning labs operating, but not have those children go into the face-to-face instruction in the classroom, because that's going to create inequity and an inequitable access. So we want to make sure we're still providing that employee benefit of the supervision and a place for our staff to bring their kids, their school-age kids, but not have them push into the classroom, because we really want to get as many kids in the classroom as soon as possible, as soon as we can do that safely, but we don't want to create inequity in the process. So, Dr. Faust, I don't know if you want to add something else to that.
That's good.
Ms. Farno, sorry. I did get a question from somebody about people being able to take off their masks during PE. Is that something we're permitting?
Yes, so we have created for principals and other supervisors a kind of a toolkit for mask use. So one thing would be the mask exception and thinking through that, but the rest of it is really guidance on how masks are to be worn throughout the building. And those include directions for teachers on how to operate mask breaks in the classroom at like 5 minutes at a time, and for when students aren't moving around. Also, how to handle mask hygiene when they're eating or drinking. But then also when you get to PE or having any other kind of strenuous activity outside, really trying to have those things done outdoors as much as possible. So PE outdoors as much as possible. And then for strenuous activity, we're really following the North Carolina High School Athletic Association guidance on when masks should be worn and when they shouldn't, but we've got clear guidelines written out for those.
I guess I just have, outside's great, but, my only concern is that in order to go to the gym, you have to have a mask on while you're exercising. So, it's just kind of weird where the kids are taking gym and they could take the mask off inside.
Are they going to be taking the mask off in gym?
So we're, the guidance document says have PE outside as much as possible, and the only time you would have the mask off is during strenuous activities. And we have a list of what are not strenuous activities and what are strenuous, because you don't want to limit airflow for, strenuous activity. But we're really focusing more on, if you have those situations where they're engaged in strenuous activity, they need to make sure that you're maintaining more than 6 feet. But again, we're focusing on try to do that outside or try not to have strenuous activities inside.
Okay, so, but they can possibly do, what's the size, well, I'm concerned, what about the size of the PE classes in a gymnasium?
Depending upon our plan we go with, so right now we're on the 1/3, and then if we go to the half and half, of course, we're still, or the 50%-ish, we're still in the smaller populations and having a great space, a large space for that.
But they're masks off in the gym if they're doing strenuous activity?
Yes.
And it's mainly an airborne virus.
Right. So the guidance for PE, and again, I'm not the PE expert, but on the health part of it, the guidance is only when it's strenuous activity, and really try to focus on having that activity outside and have PE outside as much as possible. So it doesn't mean that we absolutely can't have strenuous activity in the gym, because there might be times when they need to do that, but if so, they've got to have great physical distancing so that they're not around each other at that time.
What about this mask break situation? Describe that, and again, it's an airborne virus and you're in a closed space.
And so we have worked with public health on the creation of any mask breaks, because also we need for folks to be able to have good respiration. So we don't want to limit respiration, because then you can actually become more ill. So the mask breaks would require that it's a teacher directed or a staff directed 5 minutes. They would be seated. There would be no walking around. They're in a non-mobile. There's a word that we have. I didn't look at any of this before. I just walked up here and just started talking with you. But they're stationary is the word I'm thinking about.
Yeah.
Thank you.
Yeah.
All the words. They have to be stationary, and it can be no more than 5 minutes. And so we know that exposure. And of course, they are more than 6 feet apart, so 6 feet or more. And so for 5 minutes, 6 feet or more without a mask, to practice maybe breathing activities and staying stationary, public health is fine with us doing that, and the benefits outweigh the risk.
All right, thank you.
Because it's 5 minutes, and 15 minutes is what creates an exposure, potentially.
Okay. See, you're explaining it to me.
Yeah.
Dr. Faust, we talked a little bit about PE. Obviously, that's going to lead to athletics. So hopefully, y'all are starting to talk. I know Wake County, I think, decided last week to start allowing like cross country, and as of October 1st. So hopefully, we can start those discussions here pretty soon as well.
All right, so I believe, thank you, Ms. Barnum. I believe that
Could the old folks at home get a question in?
Absolutely. Mr. Rivenbark, are you speaking of yourself?
Well, I've been trying to talk for about 15 minutes
I'm
and I
sorry.
couldn't get in. I was just wanting somebody to tell me that year-round schools are out this Friday for fall break and they don't come back until October the 12th. How are they going to fit in all this?
We're meeting tomorrow with principals, and at that time, we're going to discuss with principals what they feel would be the best course forward for their teachers. Because, as you said, they will be out until we return on October the 12th. But we will make them the highest priority.
Okay.
Okay. So I
That's
believe
all.
oh, yes.
He said that's all.
Oh, that's all? Okay. Just to double check, Ms. Nichols, anything else from you?
No, thank you very much.
All right.
Us old folks just trying to hang in there, though.
I don't want to exclude
Yeah.
our remote participants. All right, so I believe that we have established that we need a vote to move to an AABB model.
Madam Chair, at this time, I would like to move to adopt an AAB model while quickly adding my thanks to you and to Dr. Faust. I talked a lot to teachers, and I hope this comes as a relief to them. They are exhausted, and most of the ones I talked to believe this will be a big benefit to lessen that a little bit. So thank you very much for listening.
We have a motion to move to an AABB model within the B plan. Is there a second?
I would like to second it. Jeanette Nichols.
Thank you, Ms. Nichols. Any other discussion?
I do want to say something. We as board members received an email from someone this afternoon about some of the comments a board member made. And it was about parents who were wanting to have Plan A. That board member said that they were right-wing, non-mask wearing, getting shots, and I think there can't be anything further from the truth. I mean, we did a model. I understand where the vote's going to go. We did a model. 65% of the parents wanted to go back to face-to-face. They're advocating for their kids. I mean, I think we're all here advocating for our kids. We just have different ideas of ways to get there. We all want to get to the same spot, but so that's where it is. But to say some of the things that were in that email about some of these parents, and I guess indirectly about me, because I was the one that was saying Plan A, I think that's pretty disgusting, to be honest with you.
Couldn't agree with you more, David.
And I'm going to vote against the AABB model simply because I would like for us to see to go to the A. It's not a vote against the A. It's more of a vote for the Plan A. But I'll tell you what, all those parents that have emailed us, because I bet we probably, I don't know where it comes, probably 50-50, 60-40 probably for Plan A. I think the community, we're split. Parents want a choice. So ultimately, this is a choice because you can do remote learning, virtual academy, or the AAB model. I wish it was a choice for Plan A versus virtual. But to call those parents some of those words that board member called it is disgusting. So I just wanted to apologize to the parents that received that email. And I appreciate all the emails that we got. Stephanie mentioned that she's looked at the emails. I know I've read all the emails, except for probably the 20 that we got while we've been
Can
here.
I say something? That was referring to me. First of all, it wasn't an email. It was a private message with this lady who would not leave me alone. Went on my site and I had to take down something she had posted. It was not on an email and it was not on social media. She's a PR person. She admitted it. She was goading me, and I did send one message to her telling her what I thought about some, not you, David, some of the parents that were badgering me particularly because of the stand I've taken to protect the kids. And in that email, you'll notice all I said was that I was here to protect the kids. I did not appreciate this particular group. I'm not saying you, or most of them actually, But there's this core group of people that have literally been stalking me and
Okay.
badgering me.
Ms. Justice,
okay?
I'm gonna have to pull you back in from that one.
Okay, well, it's a
But
private
as-
message.
I get it. As elected officials, we all take our hits.
Okay,
And
well, I'll
we've all,
take the
and
hit.
we've all been through it, and as an elected official, people are going to have opinions about things that we do. And we
Absolutely.
have to be respectful and sometimes just take it on the knee, you know, and we, it just.
I'm not gonna disagree.
So I just, I appreciate both of your comments. I think that moving forward, we just need to, again, I go back to, let's look at civility. We've got to be civil with each other. This is a difficult time that we're all trying to push through. And as board members, it's our responsibility to listen. We may not agree with the emails that come through to us. We may not agree with the people in the community all the time, but we have to listen and we have to be respectful of their opinions. So on that note, we have a motion and a second to move to the AABB model. Is there any other discussion for the motion?
Dr. Faust, one last thing. When we have kind of our board meetings, our regular board meetings, can you make sure to put an agenda item within your thing, kind of giving us an update where you think you're at? Maybe some of the things that you've kind of done to look at Plan A, so people at least know that we're kind of starting evaluating that stuff. I think that would be important to just kind of maintain that communication and dialogue and show people what we're doing.
Absolutely. I would add, I think it would be beneficial to begin every meeting with that update right off the bat and give us the metrics, the numbers from the health department or from our medical professionals. I think it's a great way to start every meeting until we're back in Plan A and out of this
And
mess.
also, I think maybe look at some of the other school districts around North Carolina, maybe their successes and failures.
Yes,
As to some of the things they've done, because we can learn from them.
absolutely.
And I do appreciate, I mean, I think the last time the health department was here was in July. And so it was good to have them here again. I'm not sure if they're still here, but I thought that was a really helpful discussion.
Thank you.
And because of that, could he have an update again on October when we do meet again? Because you guys are great, and it's great to ask the source, the experts.
All right. Any other discussion?
Time to vote.
I think the only thing to add is that we are going to make sure to put it in the vote that we are pushing back the start by 1
yes.
week.
So the motion is to move,
Move to adopt the AAB model beginning on October 13th,
thank you,
October 12th.
October 12th.
October
All right,
12th.
great, thank you. Ms. Bowie? Aye.
Mr. Wortman,
No.
Mr. Bullier,
Aye.
Miss Eastep,
Aye.
Miss Justice,
Aye.
Miss Nichols,
Aye.
and Mr. Ravenbark.
Aye.
All right, motion passes 6-1.
Move to adjourn, Mr. Boyer.
All right, do we have a second?
Second.
All right, any discussion? All right, Ms. Bowie?
Miss Adams,
Aye.
Mr. Wortman,
Aye.
Mr. Bullier,
Aye.
Miss Eastep,
Aye.
Miss Justice,
Aye.
Miss Nichols,
Aye.
and Mr. Ravenbark.
Aye.
Motion passes, we are adjourned.